Hi there viewers, it's Dr. Mashhood again with another video. In this video we're going to talk about 3 common illnesses or diseases which are extremely common and they mostly remain undiagnosed in most of the general population. The reason being, if we can get on top of these 3 illnesses or diseases, the life expectancy increases dramatically. It's recommended that if a person is above 40 years old, they should have once per year check for these 3 illnesses. What are these? The first one is high blood pressure or hypertension. The second one is diabetes, and third one is high cholesterol levels. Most of the population in the South Asia do not understand the significance of these 3 illnesses. It's extremely simple to check your blood pressure once per year. It's extremely simple to get your glucose levels checked, either fasting or random, once per year. And also extremely important just to do one simple blood test per year to check whether you got high cholesterol levels or not. So why are these 3 illnesses or diseases important? These are important because all these 3 diseases separately affects most of the vital organs of the body. For example, all these 3 diseases have significant effect on the brain, significant effect on the heart, and as well as the kidneys. Let's talk about the high blood pressure or hypertension. If you have a blood pressure above 140/80, it's normally understood that you are suffering from high blood pressure. When you are having a high blood pressure or hypertension, the pressure in your blood vessels is extremely high. What that high pressure does is damages the cells of your blood vessels, and the prolonged chronic damage to these blood vessels is extremely detrimental to one's health. When we talk about the heart, the high blood pressure hypertension invariably affects the heart in 3 different ways. The first one is it causes the heart to get enlarged, which is called cardiomyopathy. It can also cause heart failure. It will affect the functioning of the heart, resulting in the heart to fail in certain ways. And third and most importantly, it can result in a heart attack. The effects of hypertension or high blood pressure on the brain is significant as well. If the blood pressure in the blood vessels is high, it might result in bleeding inside the brain, and that bleeding can result in stroke and can cause permanent damage for the rest of the life and potentially can be life-threatening. Along with the heart and the brain, the other important organ the high blood pressure or hypertension affects is the kidneys. And this hypertension can result in what's called a renal failure or kidney failure. In simple words, it will affect the functioning of the kidney. When we talk about the diabetes, it's extremely important if any of the family members of a person suffers from diabetes, they should get your diabetes or blood glucose checked at least once per year, and ideally in fasting. If it's not possible, then random will give you an idea about whether you're suffering from sugar or not. Now, how does diabetes or high sugar levels affect a person? First of all, it affects the heart, and it can result in a heart attack. Secondly, it can also affect the brain and result in stroke, and is one of the important risk factors for causing stroke. The commonest effect of diabetes is in the eyes and the kidneys. In the eyes, the glucose can get deposited, high levels of glucose can get deposited, resulting in cataract and glaucoma, and eventually that can affect the vision or can also lead to blindness. In the kidneys, similar to hypertension, diabetes can also cause renal or kidney failure, essentially affecting the functioning of the kidneys. The third most important, which is most likely overlooked in most of the patients, is cholesterol levels, especially the diet we have as in South Asia, which is rich in oils and fatty food. It's most likely patients or general population will have high cholesterol levels. Now, there are 2 different types of cholesterols. One is called a good cholesterol and a bad cholesterol. The bad cholesterol are the ones which affects the body. The way it affects the body is high levels of cholesterol or the bad cholesterol over time gets deposited in the blood vessels. The more deposit it gets, the more blockage or narrowing of the blood vessels it does. And eventually a stage will come when that blood flow in that blood vessel will be blocked by the cholesterol particles or the thrombus, which will result in lack of blood supply to either heart or the stroke. If the lack of blood supply happens to the heart, this will result in a heart attack, and if it happens to the brain, this will result in stroke. Now, all these three conditions, such as hypertension, diabetes, and high cholesterol levels, can be changed or corrected by three simple things. First of all is lifestyle modifications, such as getting walking or running or jogging incorporated into your daily lifestyle. Even a half an hour of running or walking will do wonders in controlling these three diseases. If lifestyle changes hasn't made an impact, then balanced diet needs to be looked at. Ideally, you should avoid salts in blood pressure or hypertension. You should avoid high sugar levels in diabetes, and you should avoid fatty food and oily food in cholesterol. If, for example, you've done lifestyle changes, you've looked after your diet and taken balanced diet, then too you haven't had control of any of these three, then it's imperative you start medications to control these. Because the longer you delay controlling these three or any of these three, the more detrimental it will have effect on your health. Hope this video gives you some information. Later on, we're going to talk separately about diabetes, high blood pressure, and cholesterol in coming videos. Please subscribe to the channel and like this video. Thank you very much.